Sally arrives at the clinical office for a routine prenatal appointment. She becomes red in the face as she states that lately she has been craving and ingesting dirt. Which of the following is the most appropriate response from the nurse? A. You must be admitted to the hospital. B. Do you have a history of psychiatric illness? C. You must stop immediately. D. Where have you been obtaining the dirt that you're ingesting? E. Why would you eat dirt? The answer is D. Where have you been obtaining the dirt that you're ingesting? During pregnancy, many women crave and eat substances that adults do not generally ingest. This condition is normal and is called pica. Often, the substances do not have high nutritional value. Examples are dirt, chalk, rocks, toothpaste, toilet paper, etc. It is important to determine the risks involved with ingesting these materials. For example, the nurse must determine that a woman who is eating dirt does not ingest potting soil mixed with fertilizer and other potentially toxic chemicals. Your patient is under 24-hour fetal monitoring and observation. The fetal monitoring strip begins to show decelerations, starting after the peak of contractions and recovering late. Which of the following interventions does the nurse anticipate doing? A. Administering medication. B. Reposition mother. C. Fluid bolus with normal saline, NS. D. Removing oxygen supplementation. E. Increasing rate of oxytocin. The answer is B. Reposition mother. Late decelerations are caused by uteroplacental insufficiency. The nurse should anticipate many interventions to promote uteroplacental blood flow. Initially, the nurse should implement oxygen supplementation, stop the oxytocin infusion, reposition the mother to the left side, and introduce a fluid bolus of lactated Ringer's solution, LR. The nurse is reviewing a fetal monitoring strip. Decelerations are onset with the beginning of each contraction and recover at the end of each contraction. Which type of deceleration is this, and why does it occur? A. Variable decelerations, umbilical cord compression. B. Late decelerations, uteroplacental insufficiency. C. Early decelerations, head compression. D. Variable decelerations, head compression. E. Early decelerations, uteroplacental insufficiency. The answer is C. Early decelerations, head compression. A fetal heart rate, FHR, deceleration occurs when the FHR drops 15 bpm below baseline for a period of 15 seconds when the gestation is more than 32 weeks and 10 bpm below baseline for 10 seconds when gestation is less than 32 weeks. When the onset of the deceleration occurs at the onset of a new contraction and recovers with the end of the same contraction, the strip is demonstrating early decelerations, and the fetus is exhibiting head compression. Late decelerations occur when the deceleration begins after the start of a contraction and does not resolve until after the contraction has finished. Late decelerations are the result of uteroplacental insufficiency. A variable deceleration is caused by cord compression, and appears as a brief drop in FHR from baseline then resolves quickly, creating a V shape on the strip. Which of the following describes a Category 2 fetal heart rate, FHR, tracing? A. Baseline 100 bpm, absent variability, 1 acceleration, prolonged decelerations. B. Baseline FHR 170 bpm, moderate variability, 2 accelerations, 0 decelerations. C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. D. Baseline FHR 145 bpm, moderate variability, 2 accelerations, 0 decelerations. E. Baseline FHR 90 bpm, marked variability, 0 accelerations, late decelerations. The answer is C. Baseline FHR 100 bpm, minimal variability, 0 accelerations, variable decelerations. A Category 2 fetal heart rate tracing include all FHR tracings that are not Category I or Category 3. Category 1 FHR tracings are as follows: baseline 110 to 160 bpm, moderate variability, absent late or variable decelerations, present or absent early decelerations, and present or absent accelerations. Category 3 FHR tracings are as follows: absent baseline FHR variability, recurrent late decelerations, recurrent variable decelerations, bradycardia, and sinusoidal patterns. Which of the following is not a risk factor for gestational diabetes? A. Obesity. B. Poor diet. C. Previous stillbirth. D. Previous macrosomic infant. E. Family history of diabetes. The answer is B. Poor diet. Risk factors for gestational diabetes include obesity, family history of diabetes, history of gestational diabetes, hypertension, preeclampsia/eclampsia, recurrent urinary tract infections, vaginitis, polyhydramnios, previous large infants, 9 pounds or greater than 4,000 grams, glycosuria or proteinuria on 2 or more occasions. While poor diet may contribute to diabetic concerns, it is not directly associated with a higher risk of gestation diabetes as the other risk factors are. During the prenatal period, nurses are responsible for educating their patients on all of these risk factors as well as a proper prenatal diet. The nurse is observing the fetal monitoring strip of a 37-week-old fetus. He observes a visually apparent and abrupt increase in fetal heart rate, FHR, from a baseline of 140 to a peak of 159. The FHR returns to baseline after 20 seconds. What type of fetal heart rate characteristic has occurred? A. Deceleration. B. Recurrent acceleration. C. Prolonged acceleration. D. Acceleration. E. Tachycardia. The answer is D. Acceleration. An acceleration in fetal heart rate is defined as a visually apparent and abrupt increase in FHR, where the FHR increases from the onset of the acceleration to the peak in less than 30 seconds. At less than 32 weeks, the acceleration must peak at least 10 bpm above baseline and last at least 10 seconds. At more than 32 weeks, the acceleration must peak at least 15 bpm above baseline and last at least 15 seconds. A prolonged acceleration follows the same guidelines as an acceleration, but lasts more than 2 minutes and is not longer than 10 minutes in duration. After 10 minutes, it is a change in baseline FHR. A deceleration is a visually apparent decrease in FHR from the baseline, gradual or abrupt, that returns to the original baseline. Recurrent accelerations occur with more than 50% of contracts in any 20-minute window. Tachycardia is a baseline FHR of more than 160 bpm. The nurse observes an electronic fetal monitoring strip. Upon review, the fetal heart rate, FHR, undulates from 140 bpm to 160 bpm and back down to 140 bpm in a consistent cycle over a period of 35 minutes. What type of fetal heart rate characteristic is occurring on this electronic fetal monitoring strip? A. Intermittent. B. Variable. C. Bradycardia. D. Recurrent. E. Sinusoidal. The answer is E. Sinusoidal. A sinusoidal pattern is a visually apparent, smooth, sine wave-like undulating pattern in fetal heart rate baseline with a cycle frequency of at least 3 to 5 minutes that persists for more than 20 minutes. Variable describes an abrupt deceleration of visually apparent decrease and return in fetal heart rate, FHR, from baseline lasting less than 30 seconds. Bradycardia occurs when the baseline FHR is less than 110 bpm. Intermittent describes an acceleration or deceleration occurring with less than 50% of contractions in any 20-minute window. Recurrent describes an acceleration or deceleration occurring with more than 50% of contractions in any 20-minute window. In a fetus positioned at left occiput anterior, LOA, where should the nurse assess the fetal heart rate, FHR? A. Above umbilicus on mother's right side. B. Below umbilicus on mother's right side. C. Above umbilicus on mother's left side. D. Below umbilicus on mother's left side. E. At level of umbilicus. The answer is D. Below umbilicus on mother's left side. When considering where to hear fetal heart rate best, the nurse must consider the location of the fetal back. Weeks gestation or size may also affect the location of the best place to assess fetal heart rate. LOA, or left occiput anterior, is the most common fetal lie. A fetus in LOA is in vertex presentation with the fetal occiput on the mother's left side toward the front of her pelvis. In LOA, the FHR is best heard below the umbilicus on the mother's left side. In LOP, left occiput posterior, the FHR is best heard on the mother's left side at the level of the umbilicus. In ROA, right occiput anterior, the mother's right side below the umbilicus. In ROP, right occiput posterior, the mother's right side at the level of the umbilicus. In LSA, left sacrum anterior, the mother's left side above the umbilicus. In RSA, right sacrum anterior, the mother's right side above the umbilicus. What is the triad of presenting symptoms with endometriosis? A. Dysmenorrhea, infertility, and dyspareunia. B. Dysmenorrhea, metorrhagia, and dysuria. C. Hirsutism, infertility, and oligomenorrhea. D. Menorrhagia, infertility, and dyspareunia. The answer is A. Dysmenorrhea, infertility, and dyspareunia. The triad of presenting symptoms for endometriosis is dysmenorrhea, painful menses, infertility, and dyspareunia, pain on sexual intercourse. The most common presenting symptom is extreme, intense uterine cramps which may radiate to the back or down the thighs. Endometriosis is also a common cause of infertility due to a local paracrine effect. Pain on intercourse may be due to the implantation of endometrial cells in the vagina or the area around the cervix. Endometriosis will not necessarily result in menorrhagia, or excessively heavy bleeding. Hirsutism, infertility, and oligomenorrhea are symptoms commonly seen in polycystic ovarian syndrome, PCOS, rather than endometriosis. Which of the following increase the risk of endometriosis? A. Lack of exercise. B. Presence of an intrauterine device, IUD. C. Family history of endometriosis. D. All of these are correct. The answer is D. All of these are correct. The incidence of endometriosis increases significantly in individuals with a family history of the condition. Other contributing factors are sedentary lifestyle, lack of exercise, presence of an intrauterine device, a diet high in fat, the presence of estrogen dominance, and liver dysfunction, due to decreased estrogen metabolism. Which of the following is a possible cause of vaginal bleeding in early pregnancy? A. Trophoblastic disease. B. Spontaneous abortion, miscarriage. C. Cervical ectropion. D. All of these are correct. The answer is D. All of these are correct. All of these could be possible reasons for bleeding in early pregnancy, including physiologic or implantation bleeding. Bleeding may indicate threatened miscarriage or other serious condition, or it may simply be due to the implantation of the embryo into the endometrium. Which of the following terms denotes a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration? A. Amenorrhea. B. Metrorrhagia. C. Menometrorrhagia. D. Oligomenorrhea. The answer is C. Menometrorrhagia. Menometrorrhagia is a term used to describe a menstrual cycle that is irregular, of shorter duration than normal, and of excessive volume or duration. Amenorrhea is the absence of a menstrual cycle. Metrorrhagia is a term for a menstrual cycle that is of normal flow duration and volume, but which is irregular and has a shorter than normal cycle length. Oligomenorrhea describes a menstrual cycle that is longer than 35 days, often characterized by a prolonged follicular phase. Pregnant individuals with gestational hypertension, proteinuria, and signs of liver or kidney dysfunction should be evaluated for what potentially life-threatening condition? A. Gestational diabetes. B. Placenta previa. C. Ectopic pregnancy. D. Preeclampsia. The answer is D. Preeclampsia. Preeclampsia is a potentially life-threatening disorder that generally includes gestational hypertension, proteinuria, edema, red blood cell dysfunction, and signs of liver or kidney dysfunction. It is more common in weeks 32 to 40 and develops in 2 to 8% of pregnancies worldwide. At what point does preeclampsia develop into eclampsia? A. At the initiation of kidney failure. B. At the progression into seizures. C. When there is evidence of vascular dysregulation. D. When blood pressure exceeds 160/95 mm of mercury. The answer is B. At the progression into seizures. Preeclampsia develops into eclampsia at the onset of seizures. Seizures are tonic-clonic and may appear during pregnancy, during labor, or postpartum. It is relatively rare, affecting only approximately 1.2 to 1.8% of pregnancies. What is the most common time for miscarriages to occur? A. 0 to 12 weeks. B. 12 to 20 weeks. C. 16 to 24 weeks. D. 22 to 28 weeks. The answer is A. 0 to 12 weeks. The most common time for miscarriage to occur is during the first trimester, between 8 and 12 weeks. This may even occur before an individual is aware that they are pregnant. Chromosomal abnormalities are identified in approximately 50% of first trimester miscarriages, while later miscarriages may be more likely in individuals with uterine malformations or cervical incompetence. Which of the following is a risk for preeclampsia? A. Diabetes. B. History of hypertension. C. Primigravida. D. All of these. The answer is D. All of these. There are several risk factors for preeclampsia. These include history of hypertension, diabetes, older maternal age, first-time pregnancies, primigravida, and pregnancies with twins or multiples. A labor and delivery nurse is assessing a newborn infant and notes that the infant appears to be jaundiced. What is a possible cause for this condition? A. The baby has been born HIV positive, as the mother was unable to afford HIV medications. B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving RAGAM during the pregnancy. C. The infant is experiencing fetal alcohol syndrome, as the mother admitted to utilizing drugs and alcohol throughout the pregnancy. D. The mother had gestational diabetes causing jaundice of the infant. E. The mother has exposed the infant to an active genital herpes outbreak. The answer is B. The mother's blood is Rh negative and gave birth to her second Rh positive child without receiving RAGAM during the pregnancy. Jaundice of a newborn may be either pathologic or physiologic. Pathologic jaundice is usually the result of Rh incompatibility between the mother and the fetus. It occurs during a subsequent birth after the mother's blood has been exposed to the infant's blood during the first birth. RAGAM is given to the mother to prevent her immune system from attacking the second fetus, causing erythroblastosis fetalis and subsequent pathological jaundice. A labor and delivery nurse is monitoring a client in active labor after receiving epidural anesthetic. Upon assessing the client, she notes that the patient's blood pressure has fallen to 95/75 mm of mercury. The nurse's first action should be: A. Obtain an ECG. B. Give 1 mg epinephrine. C. Contact the physician immediately. D. Increase IV fluids. E. Place in semi-Fowler's position. The answer is D. Increase IV fluids. The first action should be to increase fluids, place on their left side and give oxygen. It is not necessary to contact the physician until all nursing interventions have failed. Epinephrine, a vasopressor, should be reserved for emergent situations only. A 26-year-old female primigravida presents to the clinic to discuss her estimated date of birth, EDB. The nurse records the client's first day of her last menstrual period as February 28, 2015. What would be her EDB? A. December 6, 2015. B. December 5, 2015. C. November 5, 2015. D. December 7, 2015. E. November 28, 2015. The answer is B. December 5, 2015. The calculation of an estimated date of birth requires applying Nclex rule, where once determining the first day of the client's last menstrual period, subtract 3 months and add 7 days and 1 year. The labor and delivery nurse is caring for a pregnant client that is experiencing contractions and has been on an external tokadynamometer to measure fetal heart tones as well as uterine contractions. The nurse notes that there are decreases in the fetal heart rate at different times of a contraction. The nurse is aware that this type of finding is consistent with variable decelerations, which are indicative of which of the following: an uteroplacental insufficiency. B. The effects of decreased pitocin infusion. C. A prolapsed umbilical cord or knuckle cord. D. The third stage of labor. E. Fetal head compression during contraction. The answer is C. A prolapsed umbilical cord or knuckle cord. Variable decelerations can occur at any time during a contraction, or without a contraction. They are caused by the umbilical cord that is prolapsed or wrapped around the fetal neck, also known as a knuckle cord. The compression of the cord can ultimately lead to fetal hypoxia, and therefore an intervention will be required to alleviate the compression. A 24-year-old primigravida client has just given birth to a Rh-positive child and she herself is Rh-negative. The nurse recognizes this situation can lead to future problems in terms of future pregnancies due to this blood type mismatch. All of the following are associated with Rh factor incompatibility except dash. A. May lead to fetal anemia and lead to an acceleration of red blood cell production if the mother is not given Rho, D immune globulin to prevent antibodies from destroying fetal blood cells. B. The mother will form IgG and IgM antibodies in response to being exposed to a fetus incompatible blood type. C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. D. The mixing of fetal blood with maternal blood may occur during an amniocentesis or early separation of placenta during birth. E. Kernicterus is a potentially serious effect due to pathological jaundice that can have long-lasting neurological effects on the child if not prevented. The answer is C. A major effect of Rh incompatibility is an increased risk of blood clotting and thrombosis in the fetus during subsequent pregnancies. Blood clots are not a common effect in the fetus due to Rh incompatibility. A disorder known as erythroblastosis fetalis is a type of hemolytic disease that occurs in the fetus due to an immune reaction of the Rh-negative mother in an Rh-positive fetus. All other choices are associated with this type of incompatibility. Which type of abortion is associated with sepsis, cramping, abdominal tenderness and an open cervical loss? A. Threatened abortion. B. Spontaneous abortion. C. Inevitable abortion. D. Complete abortion. E. Missed abortion. The answer is E. Missed abortion. A missed abortion is marked by the death of the fetus in utero but is not expelled from the uterus. If left untreated, can lead to infection in the womb. It is marked by foul odor and bleeding as well as an elevated temperature and sepsis. Which of the following statements is true about a high-data-deformed molar pregnancy? A. A molar pregnancy is a type of ectopic pregnancy in need of dilation and curettage to prevent internal hemorrhaging or possible hysterectomy. B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. C. The cause of a molar pregnancy is due multiple ovum becoming fertilized and coalescing to form a cluster of atypical cells containing a haploid number of chromosomes. D. A molar pregnancy can proceed without incident once Rhod immune globulin is administered to the E. A high data to form molar pregnancy is reported to cause malignancy in approximately 60% of cases. The answer is B. An ultrasound usually reveals a mass resembling a cluster of grapes, and a blood test will reveal a positive pregnancy result due to elevated HCG, human chorionic gonadotropin, hormone. A high data to form molar pregnancy is mostly a benign process that may occur due to an abnormal ovum becoming fertilized and growing into collection of cells in a cluster-like formation. They are benign over 80% of the time. Rhod immune globulin is a medication administered to an Rh-negative mother that will give birth to a second Rh-positive child to prevent an immune reaction that may harm the child. A woman is hospitalized for preeclampsia. Which medication may the nurse administer to prevent the occurrence of seizures? A. Calcium gluconate. B. Zolpidem. C. Pitocin. D. Nubane. E. Magnesium sulfate. The answer is E. Magnesium sulfate. Magnesium sulfate is used to prevent seizures in women with severe preeclampsia. Calcium gluconate is the antidote if magnesium toxicity is assessed. It should be readily available when a woman is receiving magnesium sulfate. Pitocin is used to stimulate the uterus, often to induce labor. Nubane is an opioid that can be given to women during labor to treat pain. Zolpidem, Ambien, is a sleep aid. Jean is a 33-year-old woman who has previously had regular periods but has not gotten her period for 6 months. Which of the following would the nurse rule out as the cause? A. Cross-country running 5 times per week. B. Poor eating habits. C. Yoga once per week. D. Kidney disease. E. Antidepressant use. The answer is C. Yoga once per week. Yoga once per week, light exercise, is the least likely of the above to cause a change in regular menstruation. Cross-country or long-distance running, vigorous exercise, is more likely to cause changes to a woman's cycle. Poor lifestyle choices such as eating habits and health issues such as kidney disease can also cause irregular menstruation. Likewise, pharmaceuticals can have the same effect. Which of the following is a term for an abnormal surge or excess of electrical activity in the brain? A. Dyskinesia. B. Twitch. C. Spasm. D. Seizure. The answer is D. Seizure. A seizure is defined as an abnormal surge or excess of electrical activity in the brain. This can result in partial or total loss of consciousness, and may cause muscular spasms, twitches, or other types of dyskinesia, disorders of movement. Spasms, twitches, and dyskinesias are not always caused by seizure disorders, however, they may be caused by a wide range of neuromuscular dysfunctions. Schizophrenic individuals frequently have abnormally high levels of what signaling molecule? A. Serotonin. B. Acetylcholine. C. Norepinephrine. D. Dopamine. The answer is D. Dopamine. While many people with schizophrenia do seem to have dysfunctions in multiple signaling molecules, excess levels of dopamine have been clearly associated with this disorder. Hank is a schizophrenic 46-year-old male. He experiences a persistent belief that a particular television commercial actor is addressing him directly, and that the commercial was created specifically to communicate with him. What type of delusion is Hank experiencing? A. Delusion of control. B. Erotomania. C. Delusion of reference. D. Kota or delusion. The answer is C. Delusion of reference. The belief that general or innocuous events exist specifically for or relate specifically to an individual is called a delusion of reference. Examples include belief that a billboard or television commercial is attempting to communicate directly to an individual, the ascribing of significance to random coincidences, or the observation of coded signals or signs in the general environment. Charlotte is a 19-year-old female with new onset of paranoia and auditory hallucinations. She has a positive family history for schizophrenia. Recently she admitted to her nurse that she can hear what other people are thinking. As she describes it, this does not come in the form of sound, but is communicated directly to her brain. Charlotte is likely experiencing which of the following? A. Thought broadcasting. B. Auditory hallucination. C. Telepathy. D. Delusions of persecution. The answer is A. Thought broadcasting. The belief that other people can hear one's thoughts is described by the term thought broadcasting. This is a common symptom in schizophrenia. It is differentiated from telepathy in that thought broadcasting, there is a delusion that thoughts can be heard by anyone, while telepathy is generally nonverbal communication between specific individuals, and may be receptive as well as projective. Auditory hallucinations are false perceptions of sounds, or internal thought perceived as emanating from another source, while delusions of persecution can take many forms but generally include a degree of paranoia or feeling of being targeted for harm or attack. The term positive symptoms in schizophrenia refers to which of the following? A. The loss of a specific sense, such as loss of sense of smell, anosmia. B. Any cognitive excess or distortions, such as delusions or hallucinations. C. Any symptom that increases confidence or leads to grandiosity. D. Repetitive physical movements or gestures. The answer is B. Any cognitive excess or distortions, such as delusions or hallucinations. Positive symptoms in schizophrenia are any symptoms of cognitive excess or disordered thinking. These include delusions, such as delusions of grandeur or persecution, hallucinations, and disorganized speech or behavior. Which of the following conditions can decrease sensitivity to sweet and bitter tastes? A. Rheumatoid arthritis. B. Psoriasis. C. Depression. D. ADHD. The answer is C. Depression. Depression has been linked with alterations in taste sensation, including decreased sensitivity to sweetness. This may contribute in some part to the high consumption of sweet foods and certain individuals experiencing a depressive episode. None of the other conditions listed have been correlated with alterations in taste receptor function. You're an emergency department nurse taking care of a 16-year-old female who complains of fatigue and syncope. You learn that she has only been drinking water for the last 2 weeks and has only been eating a piece of bread per day for the last 4 weeks, as she is worried that her classmates may make fun of her for being too fat during her upcoming dance. Her BMI is 14. Which of the following is the most likely diagnosis? A. Bulimia nervosa. B. Anorexia nervosa. C. Binge eating disorder. D. Major depressive disorder. E. Generalized anxiety disorder. The answer is B. Anorexia nervosa. In this patient, who is a young female, which is the most commonly encountered demographic for eating disorders, she notes that she has been drastically restricting her intake of food, that she has body dysmorphic thoughts, for example thinking that she is too fat despite that her BMI is 14, and we learn that her BMI is 14. A diagnosis of anorexia can be made if a patient is restricting their eating or drinking intentionally, and or is participating in purge behavior, and has a BMI less than 17.5, as in this patient. While generalized anxiety disorder and or major depressive disorder are often comorbid in patients with eating disorders, there is not enough evidence in the example to suggest either diagnosis for this patient. A syndrome of pain in the front of the knee, frequently occurring in teenagers, manual laborers, and athletes. It's sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. What condition is described? A. Legg-Calvé-Perthes syndrome. B. Osgood-Schlatter disease. C. Patellofemoral syndrome. D. Congenital scoliosis. The answer is C. Patellofemoral syndrome. Patellofemoral syndrome presents as pain in the front of the knee, sometimes caused by wearing down, roughening, or softening of the cartilage under the kneecap. Osgood-Schlatter disease is a syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Legg-Calvé-Perthes syndrome is due to disruption of blood flow to the femoral head, leading to a vascular necrosis. Congenital scoliosis is a spinal deformity characterized by the curving of the spine at an angle greater than 10 degrees on radiography. What condition is described by the following? A syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. A. Osteomalacia. B. Osteosarcoma. C. Osgood-Schlatter disease. D. Slipped capital femoral epiphysis. The answer is C. Osgood-Schlatter disease. Osgood-Schlatter syndrome of irritation of the patellar ligament at the tibial tuberosity, characterized by painful lumps just below the knee, most often seen in young adolescents. Risk factors may include overzealous exercise, but it's ultimately thought to be caused by adolescent bone growth. Osteosarcoma, the most common bone cancer in adolescent populations, can present with pain and a lump or frank swelling. This is caused by actual tumor growth, not by any ligamentous issue. Osteosarcoma does present frequently in the knee, and must be ruled out before a diagnosis of Osgood-Schlatter disease is made. Slipped capital femoral epiphysis causes pain and reduced movement in the hip, rather than the knee. Osteomalacia is a general softening of the bones caused by a deficiency in vitamin D. What condition will show a pencil in cup deformity on X-ray? A. Psoriatic arthritis. B. Juvenile rheumatoid arthritis. C. Rheumatoid arthritis. D. Osteoarthritis. The answer is A. Psoriatic arthritis. Psoriatic arthritis will often show a pencil in cup deformity on X-ray. Osteoarthritis will show joint space narrowing, sclerosis, and osteophytes. Rheumatoid arthritis and juvenile rheumatoid arthritis will both show soft tissue swelling, joint space narrowing, and may show marginal erosions. Rheumatoid arthritis typically presents with what type of deformity in the distal joints of the fingers? A. Shepherd's crook deformity. B. Heberden node. C. Swan neck deformity. D. Pencil in cup deformity. The answer is C. Swan neck deformity. Swan neck deformity is often seen in patients with rheumatoid arthritis. This is a state in which the distal interphalangeal joint, dip, becomes hyperflexed, bends toward the palm, while the proximal interphalangeal joint, pip, is hyperextended, bending away from the palm. Shepherd's crook deformity is seen in Paget's disease of the bone, pencil in cup deformity is seen in psoriatic arthritis, and Heberden nodes are frequently seen in the distal phalanges of patients with osteoarthritis. What is the most common form of muscular dystrophy? A. Emery-Dreifuss. B. Duchenne. C. Becker. D. Myotonic. The answer is B. Duchenne. Duchenne's is the most common and most severe form of muscular dystrophy, accounting for a full 50% of cases of muscular dystrophy in the U.S. The next most common type is Becker's, followed by myotonic muscular dystrophy and Emery-Dreifuss. Which of the following conditions is associated with autoantibodies to presynaptic calcium channels? A. Myasthenia gravis. B. Lambert-Eaton syndrome. C. Dermatomyositis. D. Multiple sclerosis. The answer is B. Lambert-Eaton syndrome. Lambert-Eaton syndrome is a condition of progressive muscle weakness caused by an autoantibodies to presynaptic calcium channels in the neuromuscular junction. This does not allow calcium to enter the presynaptic cell, which is required for neurotransmitter release into the synaptic cleft. Without the release of neurotransmitter, there will be no muscular response. Myasthenia gravis is an autoimmune condition in which antibodies are formed against acetylcholine receptors, and muscular weakness in multiple sclerosis is caused by destruction of myelin in the CNS due to antibodies against oligodendrocytes. Dermatomyositis is an inflammatory connective tissue condition that may be associated with a post-viral autoimmune reaction or triggered by a perineoplastic syndrome. What are the classic histological findings of dermatomyositis? A. Fibrous muscle fibers and fatty infiltrates. B. Parafascicular muscle fiber atrophy and fatty infiltrates. C. Granulomas and necrotic muscle fibers. D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. The answer is D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Histological findings of dermatomyositis will generally reveal mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Fibrous muscle fibers and fatty infiltrates are typical of Duchenne's muscular dystrophy, while granulomas in muscle are rare but may be seen in sarcoidosis and other conditions of granulomatous myositis. 90% of adult rhabdomomas are located in what area? A. The calf. B. The upper arm. C. The lower back. D. The neck. The answer is D. The neck. A rhabdomyoma is a benign tumors of striated muscle. 90% of adult rhabdomomas present as round masses in the neck. What dermatological condition is often seen with dermatomyositis? A. Periorbital heliotrope rash. B. Perioral dermatitis. C. Dermatitis herpetiformis. D. Miller rash. The answer is A. Periorbital heliotrope rash. A periorbital heliotrope rash is often seen in dermatomyositis. It is bilateral, symmetric, purpuric, and macular, and erupts over the eyelids and surrounding periorbital area. Miller rash, often called a butterfly rash, is seen in patients with systemic lupus erythematosus, SLE. Dermatitis herpetiformis is a rash on the elbows and knees generally seen with gluten allergy, celiac disease. Perioral dermatitis is an iatrogenic condition often associated with prolonged use of topical steroid creams. What condition typically presents as symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness? A. Dermatomyositis. B. Myasthenia gravis. C. Guillain-Barré syndrome. D. Polymyositis. The answer is D. Polymyositis. Polymyositis is characterized by symmetric proximal muscle weakness in the upper and lower extremities, often without the presence of distal muscle weakness. The first sign is often weakness in the thighs while walking, the inability to rise from a seated position without assistance, or the inability to raise the arms above the head. Dermatomyositis generally includes a characteristic periorbital rash. Weakness is expressed in the neck, arms, and legs. Guillain-Barré syndrome is an ascending paralysis. Symptoms start in the hands and feet, then spread proximally as it progresses. Muscular weakness in myasthenia gravis is often especially expressed in muscles of the face and head, especially those that control eye and eyelid movement, facial expression, chewing, swallowing, and speaking. What condition is characterized by high bone turnover due to accelerated osteoclast and osteoblast activity? A. Osteogenesis imperfecta. B. Giant cell tumor. C. Paget's disease of bone. D. Multiple myeloma. The answer is C. Paget's disease of bone. Paget's disease of bone is a condition characterized by high bone turnover due to accelerated osteoclast and osteoblast activity. This results in increased calcification of bones, especially prominent in the skull, pelvis, femur, and tibia. Osteogenesis imperfecta is an issue with collagen formation that causes fragile bones and multiple fractures. Multiple myeloma is a malignancy of plasma calls, and giant cell tumors are rare tumors that generally originate from the epiphysis of long bones, with no effect on bone deposition. At what age will Paget's disease of the bone generally first present? A. Over 70. B. Children ages 6 to 12. C. Early adolescence. D. Over 55. The answer is D. Over 55. Paget's disease of the bone generally presents in after the age of 55, and is very rare in younger individuals. The prevalence in individuals over 55 is as high as 3%. Which of the following is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone? A. Osteoid osteoma. B. Ewing's sarcoma. C. Osteosarcoma. D. Fibrosarcoma. The answer is A. Osteoid osteoma. Osteoid osteoma is a benign, bone-forming tumor characterized by a small area of neoplastic growth surrounded by an area of mature, reactive bone. Fibrosarcoma, osteosarcoma, and Ewing's sarcoma are all malignancies. What is the most common primary malignancy of the bone, excluding hematopoietic malignancies? A. Osteoid osteoma. B. Fibrosarcoma. C. Ewing's sarcoma. D. Osteosarcoma. The answer is D. Osteosarcoma. Osteosarcoma is the most common primary malignancy of bone, excluding hematopoietic malignancies, making up approximately 20% of all primary bone cancers. Fibrosarcoma and Ewing's sarcoma are relatively rare conditions, and osteoid osteomas are as non-malignant. About 75% of osteosarcomas occur in what region? A. The upper arm. B. The distal femur or around the knee. C. The pelvis. D. The thoracic spine. The answer is B. The distal femur or around the knee. Roughly 75% of osteosarcomas occur in the distal femur or around the knee. The next most common site is the upper arm. Spinal or pelvic involvement are rare. The majority of osteosarcomas occur in what age group? A. Individuals over 65 years of age. B. Preteens and adolescents. C. Middle age. D. Children under 10. The answer is B. Preteens and adolescents. The majority of cases of osteosarcoma are in children and adolescents between the age of 10 and 25. It's the most common type of bone cancer in children and young adults, and the third most common cancer in teens. Which of the following is a neurological movement disorder typified by sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain? A. Geniospasm. B. Dystonia. C. Bulismus. D. Torticollis. The answer is B. Dystonia. Dystonia is a condition of sustained muscle contractions causing abnormal posture, twisting, restricted movement, and pain. Torticollis is a form of dystonia specific to the muscles of the neck. Bulismus is a condition of rapid, violent involuntary motions. Geniospasm is specific to the mentalis muscle, causing involuntary movements of the jaw. A 35-year-old male client presents to the emergency department after sustaining a severe tibial fracture to the left leg. The nurse is assessing the injury for possible complications including compartment syndrome. All of the following interventions would be appropriate to compartment syndrome except dash. A. Assess the bandage applied, loosen if necessary. B. Assess urine output for dark smoky urine. C. Elevate the injured limb and apply ice packs. D. Notify the physician if no peripheral pulses are detected. E. Assess for paresthesis, pallor, and pain in the left lower leg. The answer is C. Elevate the injured limb and apply ice packs. Elevation of the limb above the heart may slow arterial perfusion and raise venous pressure, and worsen circulation. Ice may cause vasoconstriction and further lead to circulation compromise. Both of these interventions would not be appropriate for compartment syndrome. Know the 6 P's of compartment syndrome: pallor, pain on passive movement, paresthesia, paralysis, pulses, pressure. All of these may be present in compartment syndrome. Pulselessness is an ominous sign of impending permanent damage. The physician should be notified. Muscle damage can lead to myoglobinemia of the blood, thereby damaging the kidneys, leading to rhabdomyolysis and dark urine. A tight bandage could further increase the pressure in the compartment and should be loosened if this is so.